This film brings together professionals from health, social care and education to discuss some of the situations highlighted in 2 parental mental health case studies featured on Social Care TV. Wendy, a mother's story, and Cait, a young person's story. Each professional has experience of dealing with parental mental health issues in the voluntary sector, in education, in community mental health and in family centres. The discussion is mediated by Rose De Paeztron, Head of Strategic Development at Family Action, a charity that supports disadvantaged families throughout England. She's joined by Paul Taylor, Assistant Head Teacher with responsibility for safeguarding young adults at Bellerive FCJ Catholic College in Liverpool. Allan O'Leary, Community Mental Health Team Manager with Mersey, who works with adults with mental health issues. And Ruth Haig-Ferguson, who manages a number of children's centres in central Liverpool. They begin by reviewing the story of Cait, whose mother has mental health problems.
My name's Cait, I'm 18 years old and I care for my mum, who has a few mental health problems.
Cait has been caring for her mum since the age of 7, and over the years as her mum's mental health deteriorated, Cait's responsibilities grew.
When it first started happening, we used to live in a flat and we had a balcony, and she'd want to go outside, try to go over the balcony basically. She'd wake me up and we'd just sit there talking, trying to distract her from like the voices in her head. And sometimes like she'd go to sleep at about 4 o'clock in the morning and I'd just stay awake. And like I'd go around doing like housework or something because I was too awake by then to go back to sleep. But about by 6 o'clock, maybe 7, I'd be knackered again and I'd have to sleep and it'd either make me late for school or you don't wear the right shirt for that day. And our school counsellor was just like a learning mentor. She wasn't there to be a proper counsellor. She used to say things like, you're just acting out to get attention and stuff. And admittedly I was, but not for the reasons she's thinking of. She even knew that my mum had mental health problems because she asked me what was happening at home. And then she said, well, don't bring it into school. I was like, well, what was the point in me telling you?
I wonder if we should pause there, because Cait was just saying quite a lot about some of the issues for her. I wonder if the same would be true for Cait today, if that was happening to her now, as opposed to happening a few years ago.
What I would hope would happen if there was a Cait at my school was the person that she felt confident enough to open up to would have had the necessary input to realise that there were certain textbook signals about Cait's lifestyle, you know, and straight away realise not everything is good for this child. I need to get someone else involved, rather than say to her, leave that sort of stuff at the school gates when you come in. That was a story that was crying out for a common assessment framework to be done. And quite frankly, as a teacher, I wouldn't have been able to know all of the different things.
And for me, what pops up there is that whole issue about training.
What I would like to see is that every member of staff has some level of training, so that if they are the one who can pick up on the little nuances that suggest that this is a child crying out for help, and while that person might be the one to address all her needs, they will turn to someone within the organisation who does know the contacts in the other agencies and has got the confidence to ring those agencies and start the dialogues that will lead to support for Cait.
And I think so often what you come across is perhaps on children's services side the fear of mental health issues, and then sometimes on adult side the fear of, you know, kind of dealing with children's.
Yeah, I'm just thinking through how we can actually work collaboratively with colleagues in children's services, because those of us who work and focus on adults with mental health problems, you know, the issue for us is that's who we're focusing on. And that's where our skills and expertise lie. It's not with the needs of the children. So there is that apprehension and anxiety about treading into areas that we've got no expertise in.
It's the joint training, isn't it? So that the staff from the different teams, as we do fairly well with safeguarding, we need to do it more, I think, with more skills sharing, so that adult workers can relate to workers with children and share their skills and knowledge and understanding what they all do.
Doing the joint training would be really beneficial, but again, it's about releasing staff members to do that when it's not their core work. Perhaps we could have a champion within each team that could go off and do that joint training, who could then be, you know, the spokesperson within the team to keep it on the agenda for those of us who work specifically with adults.
I think named individuals in both to do that liaison work is really good, because obviously there are practical issues that are difficult.
Because the other element of fear, I think, can be that actually I might ask a question that I almost don't want to hear the answer to, because it's going to open up such an enormous area, and I, as a practitioner, I'm afraid of how to deal with that. I'm afraid of what might be involved, and particularly perhaps for practitioners who already have a rather bulging caseload, and perhaps on a bad day it can just feel like one thing too many.
But I think it's also not to say to each group of worker that we're actually taking over your work. What we're doing, we're still just doing our own, but we're going to ask for your expertise, and seeing that in a concrete example for Cait. I think it would have helped if the school worker would have been able to have access to adult mental health services to ask their advice. Right. But if Cait was happy with that worker, you wouldn't want Cait overwhelmed with 3 or 4 different workers. So I think it's how that's done. Yeah. But it's just sharing the expertise, and then knowing, oh, I can call on them to help me. Breaking down those personal barriers, I think, sometimes.
And it's interesting that, isn't it? Because if once you know someone, then it obviously makes it easier, doesn't it, either to drop by the office or pick up the phone. One of the things raised by practitioners is that sometimes with staff turnover in teams, you might get to know, you know, Sue, and she's the person that you link with, but then maybe the 6 months goes by and you've not, you know, had much contact for whatever reason, and then you pick up the phone and know actually Sue's gone. And again, I think, is there something around confidence to then continue and not just say, oh, fine, forget it, but actually say, oh, well, sorry, you know, Sue's not there, but actually is there someone else I can talk to? That building the confidence of the practitioner on either side to be able to say, well, actually, I do need to talk to someone.
I think before we move on from Cait's story, it's very important that when Cait finally has the courage to disclose, well, this is what's going on in my life, if the member of staff even gives away the slightest hint that they're making some judgments, that Cait will either think, right, well, I need to protect my mum from that, or will communicate that judgment, and the parent themselves will think, right, well, I'm not going to involve myself with someone who has already made a judgment on me, and therefore, if you try to instigate a CAF, because it does need parental involvement, then it's going to go nowhere, because right away, all those things start to kick in about, well, if I admit to my problems, there's a chance my children will be taken away.
I think that's absolutely right. I think it takes us into that whole issue of stigma, and I'd like to sort of broaden the conversation so we start thinking about things more from the parents' side, and which was, you know, thinking about the other film and Wendy's story. So I wonder whether it'd be helpful just to have a look at that briefly. Yep.
I was married for 18 years, had 3 children. The marriage broke up, we just basically grew apart. I met somebody else, and meeting that somebody else, I got myself pregnant with my son. I had to fight for my children. I had to go from a house where I had absolutely everything, security, into going to living with someone else in 1 bedroom. And in that relationship, just before I gave birth to my son, I found out that the partner I was with was cheating on me. Then he started hitting me. All the money was going because he was gambling everything. But I bottled everything up, kept it to myself. And when I gave birth, even then, when they just give you the baby, I didn't want him. People were coming, he was just laying there crying because I just didn't want to hold him. And when the family come over, I put on a front for them. And I'd done what I had to do. I looked after him and done what I had to do, but I completely rejected him. I remember the health visitor coming round, and she got me to fill in this form, which I filled in, and she said that there's signs of postnatal depression. Did I feel fine? I told her I did. Obviously I didn't, but I said, yeah, I'm fine, everything's fine. And then because of the way I was feeling, I didn't like going out, so I never took Dominic to the health visitors for checks. I only took him for his jabs, where before with my other kids I took him every 2 weeks to get weighed, but with Dominic I didn't do that. OK, well let's pause it there, because I think we heard quite a lot from Wendy about what the issues were for her. I think, again, similar to Cait in some ways, there seem to be a lot of missed opportunities of the early intervention. For example, the children's centres could have, had they been made aware from, say, the midwives and the house visitors at an early stage, could have got in there, sorted out some of the housing problems, the kind of benefit problems, looked at the issues with some of the older children,
and why she was feeling as she did, giving her more support at that stage. Even prenatally, there's a lot of things that could be done. And with our relationships, I think with midwives and health visitors, we know that people will say that things are okay, but actually we need to probe a little bit deeper. And one of the things that we're asking at within the Women's Hospital and the early antenatal visits is to ask the right questions. I know she was asked, but I think it's asking with, you know, an increased awareness, if you like.
I think for me it's also being mindful of the situations that some people are in. You know, the alarm bells would have been going off for me in terms of her living in one room with 4 children. You know, and you know, it's also her pride in trying to keep everything together, and you know, she was saying she wasn't sharing that with family members, but she was clearly struggling, and that's bound to be having an impact on her general well-being as well as her mental health.
Yes.
And it's how we engage those people who are involved in her life, significant others, because it's not just about family, but significant people in that person's life. You know, within the community mental health teams, we would attempt to engage them, because it's about their degree of understanding and what the issues might be. It's that fine balancing issue around the service user agreeing to that. And also being very clear around what information we may share with them. You know, within Liverpool, we will provide significant others with a carer's assessment, and that's about, you know, what their needs may be and caring for that individual.
No, absolutely. And I think practical things that can help, actually working directly both with sort of parents and children and young people that are working in people's homes, is sometimes it might be something as simple as actually just sort of going through a drawer full of bills which are piled up or unopened envelopes. So firstly, the fact that you know, that's showing obviously that parent has the confidence to let you into their home in the first place. I mean, and that isn't always a straightforward and easy thing, as I'm sure many practitioners will recognise, but just that establishing a relationship of trust and then being able to offer quite practical help as well as the emotional help that goes along with that. But I wondered if you have other thoughts about some of the sort of practical helps that, you know, that you're aware of.
It's rare that somebody, I think, in Wendy's position will walk through the door of a children's centre. She needs to be guided and led. But once that relationship has been made and the trust is there, she could introduce her to a peer group of people that are in a similar position, and then maybe colleagues, even from extended school for the older children, can come into the children's centre where she is, so she doesn't need to do all that running around practically. That's one of the things they can do, is bring in and contact those people, see someone within the community mental health team or anything else can be done at the one place, kind of a one-stop shop thing.
One of the practical things I do when I'm meeting people for supervision, you know, staff members, is ask, are there any children? How are the children? How do you know? You know, just keeping that prompt and making sure that it's on the agenda.
Clearly getting it right is hard, because, you know, otherwise I guess we'd have done it by now, wouldn't we? So, but I just wondered whether you've got any thoughts about, you know, what do you think the real barriers are that get in the way? Because we've probably identified some of them around some of the sort of fear that can be around, or perhaps the need for confidence. But I wondered whether there's anything else that, you know, from your own experience, that you would like to add.
We're all very busy practitioners, aren't we? Trying to remember that there are, you know, a need to just make those links, I think. 'Cause I think sometimes it's not deliberate, it's just an unawareness and a time factor, and it's just making that extra effort, I think.
I think there's an issue for me in terms of how we deliver services now, because when I originally trained as a social worker 25 years ago, I trained as a generic social worker, so I worked with children, with families, with adults with physical health problems, older people, people with mental health problems, and you carried a generic caseload. And over time, you know, we've moved into specialist teams because we wanted to deliver the best service, but people don't fall into neat categories. And yes, and it's really encouraging to see these Sky guidelines come out, because it's getting us back to think family, think parent, think child. I think with the guidelines as well, it's challenging some of the stigma that's around with mental health. It's getting mental health up onto the agenda again.
Yeah, no, absolutely. And I think that, you know, having that framework there, I think it's, you know, what you were saying, both in terms of different disciplines, it brings people together, and it probably in terms of, you know, within organisations, actually recognition that, you know, there's a role for senior management to make sure that they're engaged and making sure that messages are communicated,
Yes.
you know, as well as actually on the ground practitioners linking up with, you know, sort of colleagues from different disciplines.
I think the guidelines gives all the senior managers the kind of backing to put that message across, and that there's a kind of reason and a reference point for why they're giving it to their staff, the message, and it is, I think it is filtering down.
Yeah.